morning, everyone. Good morning, everyone. I hope you have your coffee. Welcome back to this month's Healthcare Half Hour. This month, we're going to be talking about assisted living and penalties levied against assisted living centers and how they often don't really make any change. So first off, I want to introduce our panelists today. First off, we've got with us Bill Lamb. He's the president of the board of Friends of Residents in Long-Term Care. He used to be the head of Friends of Residents. And before that, he worked at the Department of Health and Human Services, where he split his career between the Division of Social Services and the Division of Aging and Adult Services. And he retired as the chief of planning at the Division of Aging. We've also got with us Lisa Riegel. She's the manager of advocacy and livable communities for AARP or ARPS, AARP's North Carolina office. Before that, she did active transportation advocacy. She was the head of Bike Walk NC, which I only found out this morning. And she did a lot of work around safety, in particular safety, for seniors, right? Because sometimes crossing the street and that kind of stuff. And that's how she got involved in aging policy. And finally, but not least, we have with us Tommy Goldsmith, who is our crackerjack writer, who writes primarily around aging issues and government health policy for seniors. He's a native North Carolinian with roots in Scotland County. Tommy attended the University of North Carolina at Chapel Hill and got his start in journalism at the Tennessean in Nashville in 1983 before coming home to Raleigh in 2003. He spent 33 years as an editor and reporter in daily newspapers, and he retired as the Wake County editor for the News and Observer in May of 2016. He reports on us about aging issues, as I've noted, and he is a winner of multiple state and national awards for this work. No one knows aging in North Carolina journalism the way Tommy does. So before we get started, I want to remind people that you're with North Carolina Health News this morning. We are a not-for-profit and we depend on readers like you to keep going. And you can keep up with everything that's happening in healthcare in our state by signing up for our newsletter. It comes out twice a week. Every once in a while, we'll ask you for money. But for the most part, it is a newsletter which will bring you information, links to our stories. For those of you who might be looking for jobs, we've got job postings in there. And I usually read a couple articles and kind of do some commentary on what's happening in the broader healthcare world. So without further ado, we're going to talk about our story that was published in August. It was called Appeals, Secret Deals, Delay Fine Payment for Assisted Living Centers. And I'm going to have Tommy just give a quick synopsis of what this story was and what they found. And Tommy, I'm going to ask you could you define the terms, like what's an assisted living center? What's an adult care home? Like what's the difference between them all?
Good morning, folks. Assisted living centers or adult care homes, as they're known formerly in North Carolina, are descendants of the old rest homes that counties used to have. Basically, it's a room and board type of situation that has evolved into a place where people with quite serious illness go. It's less expensive for one reason, and they can be treated there. They do get meds. They can get therapy. All this costs more, but so it's a less medicalized place. And a family care home is a similar situation, but with 6 or fewer residents. Now, people use the term nursing home to cover a large waterfront of stuff that should not be covered under that title. Nursing homes are medicalized. They are 1 or possibly 2 steps away from the hospital and possibly death. But residents there can have, as I say, quite serious conditions, COPD, various diseases that affect the entire system. So they require more attention from administrators and staff, but don't always get it.
And they require skilled nursing.
Yes, right. The technical term for that in North Carolina is skilled nursing facility. Right. So higher presence of nurses and of docs.
So we were talking about, in your story, we're talking about assisted living centers. So tell us what you found. You went looking at what happens when one of these centers has a problem and they end up having a penalty levied against them. So what happens when when they have those penalties?
Well, these are some of these are trivial, as the industry will tell you, or maybe not trivial, but not the kind of thing where you would say, oh my God, I can't believe that's happening. Some of them are, oh my God, I can't believe that's happening. We had a couple of examples in the story. People who fall and don't get picked up. I've recently looked at some since the story ran of residents assaulting each other, which can happen. But anyway, take a major or a complaint like that, it makes its way to DHHS and or county social services, which are different things. And a team of people, mostly county people, but with a state contingent, goes to the facility and does very extensive reviewing, looking at record. Ma'am?
Yep.
Are you losing me?
Keep going, keep going. Somebody's
okay, and
phone rang.
I'll wrap it up. And they do an extensive investigation of what happened. I mean, they'll say med tech so and so said this. They don't use names. And if it's found to be substantiated, then they can be penalized by DHHS and to the tune of tens of thousands of dollars. What I had noticed through the years in covering this stuff is they often don't get paid, or they rarely get paid in full unless it's $500 or something. But you can take a $20,000 penalty, appeal it, and magically it turns into a $3,000 penalty, which pays your lawyers for the effort they had to go through to get it reduced. Mm-hmm. So I think this is in the story. Penalizing facilities may not be the best way to regulate them, but it's the way we have. Mm-hmm. So the system should work as intended and exists now.
Mm-hmm. So, I mean, Bill and Lisa, I know you both have thoughts about these penalties. You know, Bill, where does this, you know, why are these penalties? What happens? Like, how does this happen?
So what happens after a penalty is actually imposed and collected by our Constitution? We've got a constitutional provision that all state fines and penalties go into our education program. So it goes directly into the funds that support childhood education, similar to our lottery. It's exactly the same thing. That's completely different from what happens with nursing homes. When nursing homes are penalized, these are federally controlled, or it's federally driven. Those funds are set aside. They're civil monetary penalties. They're set aside for each state to then use to support projects that improve the care in nursing homes. Mm-hmm. But nothing like that happens with the penalties that are actually collected related to assisted living. Those go into the education fund. So there's not an incentive necessarily for the folks who are interested in adult care homes to collect those fees to do anything productive related to improving facilities. They are used as a bargaining chip with facilities they negotiate a bit with facilities to engage in things which are going to improve care in that facility, and they'll use that as leverage to kind of reduce the penalty. All of that is not transparent. That's what the state will say they're trying to do, and I believe they're well-intended folks, but it is not subject to any oversight outside. You can't look that up. You can see what the violation was, but you can't see, so how did they negotiate it down to a certain point? And that's the problem we've had with this all along.
Mm-hmm. I know, Lisa, you've had some thoughts about these too when we talked ahead of time.
Yeah, I mean, I would just sort of build on what Bill was saying, that we need the penalties there. We need that ability to have the stick. But in reality, since those funds don't go then back to the healthcare system to improve the long-term care facilities, it's in all of our best interest to give DHSR, the oversight group, the resources they need to do those negotiations, and in a way that benefits the residents and improves the quality of the care in the facility. So we have to somehow enhance that system, because that's really important. You mentioned that some of the infractions are small, like, missed medication, not overseeing the medication properly. Well, you want to catch that as early as possible before it results in a stroke that then hospitalizes the resident. So that negotiation is important. That training for better medication oversight, whatever it is it's an important step. But we still need the stick.
And sometimes, like we saw penalties that are like, a hot water heater has a problem, which might seem like a small thing, but it might mean that then the hot water heater is running and you could get someone scalded because the water is so hot, right?
Right.
Tommy, I know you went looking. How often did the fines get levied? Do you
Are they
have the
levied?
story?
I'm not sure if we have that number. We have the percentage that are discounted to some degree or another, which I think is close to 70%.
Mm-hmm.
So they're very often the administrators, or in many cases the chain operators, make it a policy to appeal every penalty, because that can it can lower the penalty. It can also extend the time until they have to pay. I think the example in the lead had been 18 months, and that wasn't at all unusual. We were helped, I should say. Mona Dugani was the co-writer on this story.
She was our fabulous intern this summer.
Yeah, she got involved in it was my idea to have a spreadsheet, and Mona got to put it together. But we were able to calculate things like the percentage of fines lowered, the amount that it was, and all of that. So this is a first time effort as far as I know.
Right. That someone has actually done this analysis.
Mm-hmm.
We were able to see that of the fines issued, 26% got paid, 15% were referred to the controller's office, 21% had a settlement reached, and 12% other. So, what is the maximum penalty for an infraction?
So the maximum penalty for an infraction, and there are basically three levels of infractions. There's a B penalty, which are these process error. They're not minor, but people aren't subject to close to being harmed. They're a violation of some regulation. But then we have A penalties, and they're split between two parts. One is an A1 penalty. That means somebody actually got harmed as a result of an action by a facility. An A2 penalty is they observed something, and while there was not evidence that people were harmed, it's a behavior that had a great potential to cause harm. So let's say a mismanagement of medications in a way that people weren't necessarily harmed, but certainly could have in a long-term result. It would be like an A2 penalty. The maximum penalty in North Carolina for one of these violations, an A1 penalty, is $20,000.
So someone could die, and the maximum penalty is $20,000.
Yeah. Now, oftentimes what you will see, though, is that penalties against facilities are much higher than $20,000, because oftentimes when an infraction occurs, it's not just one infraction, and it's not just one resident. So what you will see is something like a $100,000 penalty, as an example, for really egregious kinds of things. But that's because multiple violations occurred and multiple residents were affected. And the other thing that often happens, and it gets a little weird, but you can have a B penalty, one of these minor penalties, and then you're given time to correct the deficiency. And if they come back and inspect you and you haven't corrected the deficiency, then what they do is they impose a daily penalty. And those daily penalties can add up to quite a bit. But for the most part, the penalties against assisted living facilities are much lower than the federal penalties against nursing homes.
Before we go any further, I want to remind people we're taking questions, so you can drop them into the chat, and we'll answer them in a couple minutes. We'll talk for a few more minutes, and then we'll get to our audience questions. I also want to remind folks that you're with North Carolina Health News, and that we're a not-for-profit, and we depend on readers like you to keep going. So, why don't these things get sort of prosecuted or like addressed, Tommy? I mean, I know you found some stuff in your.
They sometimes get addressed in one way or another, and the facility knows it's under the gun if they've, had people die or whatever, and these penalties reflect that. There's a larger point that I often hear from the industry, which is relatives, the general public, legislators need to go to these places, look around regularly, and see what's going on, because, as they always say, sunshine is the best disinfectant. If there were a stronger public presence, and this gets back to your question, a stronger public will, then there would be more money for this sort of regulation, or for the facilities themselves, in which an increase in the amount the direct care workers are paid would provide better conditions and potentially fewer violations.
But you also talked to the Attorney General's office about why, what did you find out there?
Oh yes, that was actually, I think, it's from Bill. These, if they go very far, then a lawyer from DOJ has to get involved, because the person is making a complaint against the state, and the Department of Justice, as witnessed by recent budgets, is strapped for money. And I can't imagine. Well, I think it unlikely that a smart young lawyer or assistant DA is going to want to spend his days appealing these things, because the outcome is fairly predictable. It'll be some sort of, the facility will pay more than it wants, and the state will get less than it wants. So there's not, and no one is dedicated full time to doing this. And that's a problem. I mean, it would. I mean, sorry. From the point of view of the residents, that would be a problem, because these cases would require an aggressive, defense. A defense of the action taken by the state.
If there's a bad thing that happens, anybody can weigh in here. If there's a bad thing that happens, what recourse do residents or their families have?
Well,
so the families really don't have much recourse in this process. They're not involved. They're invited to these informal dispute resolution meetings that the state will have before they participate, but most folks don't really know the landscape on that, and they rarely participate. Everything else is behind closed doors, and as Tommy has indicated, the incentives are really for the state, at both the state level and at the Attorney General's office, is to settle a dispute. They don't have the resources to contest. So the family is really left with only one alternative, and that's tort, to sue. And the part of the problem with that is that the state has imposed limitations now on malpractice suits. The maximum you can get for punitive damages is $250,000, which sounds like a lot of money, but in the grand scheme of things is really not enough to get trial attorneys that interested in this. Now, you do have actual damages if you can prove actual damages, but if somebody gets hurt, as an example, and it's a private situation, if Rose, if you got hurt and sued someone and you were not able to work, they would calculate your economic potential over your lifetime as they start calculating damages. Well, let's make that an 85-year-old person who's in an assisted living facility. And what are the economic damages for her?
Lisa, you sounded like you were going to chime in.
Oh, I was just going to point out that, and then during the pandemic, there was a kind of a broad immunity clause put in provision.
Oh, right.
Where families don't even have that recourse of tort. So that makes it even harder. So again, I get back to, we really need to improve the quality so we don't have these, these infractions, is really where we want to focus. And kind of building off what Tommy said about the evolution of long-term care, the rest homes and, hospitals, and then, the nursing facilities, and then trying to lower the cost into the adult care homes. What I think this COVID has shown us is that our system needs more scrutiny and more kind of modernization. I think we need to continue to evolve. And so fortunately, I mean, this silver lining to this pandemic is that people are looking at long-term care facilities and saying we need to do something. And I think all the advocates coming together have really been able to make some movement on important things like increased wages for the direct care workforce.
Mm-hmm.
Right.
And there is that star rating system. Like, does that help? Yeah, Lisa, why don't you?
Well, I just say that, it's not perfect. I know industry doesn't like it, but it's the only tool that if you're a consumer and you're trying to think, what tools can I use to figure out where's the best place to put my loved one? At least it's a tool. And those stars are related to those violations. If you have a certain number of violations, your star rating drops. And then that further is related to inspections. So, there is some benefit of it because facilities don't want to be inspected, so they want a higher star rating. But at the same time, as we continue to grow this aging population that needs care, are we seeing an increase in support for those inspections? That's where I think the problem is that there's not, we haven't had a budget since 2019. We know our population is growing. We knew before COVID we had a problem. It's only gotten worse. So I think we really need to look at our system and what's the ratio of caregivers to residents? Is that enough for high quality? Mm-hmm. Inspections, you have we're able to treat more complex conditions. And so you have people in these facilities that have very complicated medication schedules. Are they equipped to take care of those residents? And then that makes it harder for the inspectors to do an inspection too. So I think we just need to look at the system and make sure that we are evolving as our population ages.
Mm-hmm. Right, and it's a complex issue in terms of the folks who are involved in paying for care themselves, the private pay residents. We have a fairly broad support for indigent residents through our special assistance program and through Medicaid, and our funding. We've starved those facilities over the last several years. So particularly those facilities that take a lot of public pay residents are, they're struggling for resources to meet minimum standards. On the other hand, that doesn't mean that the higher end facilities don't have issues of their own. This is a for-profit industry, and it still requires, I think, strong regulatory oversight, strong regulations, oversight of those regulations, and quick responses in terms of finding problems and fixing them.
Mm-hmm. So I asked about questions, and Bob Conrad has been on fire. So
I've actually answered a few of them.
Well, I'd like to sort of have an opportunity to hash some of these out.
Sure.
He was looking to see if we could do an apples to apples comparison with the spreadsheet and assess the fine amount of the adult care homes if, say, the federal standard would have been applied. Tom, you said that not with the database is structured. Would that be possible at all? I mean, sometimes it's hard to find.
You'd have to figure out, what's an equivalent offense,
right?
Which would, you could look at the statute numbers and then look at U.S. statute and figure out. But even then, you wouldn't really be on the same plane. I guess very generally you could do it. I don't think it's a thing that would work well in a spreadsheet. Mm-hmm. You could probably take a few cases and look at them and figure that out.
Right. You could sort of do some examples.
Yeah.
Dick Chady was asking if there's like a hotline, or is there like a state website for residents or staff or families to report problems? Is there something like that?
There is. There is a hotline at the Division of Health Services Regulation And if you all will bear with me, I'll look that up and put it in the chat.
And what we'll do is we'll drop that into the story as a box so that folks can find it if they, stumble across the story because they've had a problem with their loved one.
Yeah, and I'll just build on that to get me back to so when you do file the complaint, then that does trigger another inspection, to someone to go in there and to investigate. So it's important that we make that the families are encouraged to help their loved one that's in a care facility by putting that complaint in. And I'm putting my advocacy hat on. One thing we've been advocating for is more funding for ombudsmen. There were national studies that said, what's the ratio? And ombudsman was someone who would help with that complaint, that there's a certain ratio of residents to ombudsman, and we don't have that ratio. We need about, I think, 6 more ombudsmen. So as I said, as this population is growing, we need to keep up pace.
Wow.
I would say, just as an observer, that these things very often get resolved before this stage ever happens. And that would be a preferable result. If you could go in, talk to staff, talk to administrators and say, Mom really looks, bad. She fell and got a bruise, but what's up with that? Or she seems really out of it, as we saw in a study just yesterday, that you're giving her too many antipsychotic drugs. So it kind of all goes back. You can't put Mom in there and then forget about her. You have to be there. And so many people I know have been there like once a day, twice a day in perpetuity.
Right. Well, there's also like, how empowered do families feel, right? They might feel like, well, if I make too many waves, they're going to kick Mom out, or, make it uncomfortable for her to be there, have retaliation. And then then the next nice place is 25 miles away and I don't have the time, so, I mean, how is that an issue too?
Yes. I mean, I think there are data that show that's a huge factor, and you can't blame people, especially if they want to be there a lot.
Right.
They don't want to go to North Wilkesboro unless they happen to live nearby. They would rather go down the road, and that's one of those mixed blessing type of things. It's close, but it's really bad. Nah, if it's close, but it's okay. Maybe by being there a lot, you can mitigate.
Right. The advice that we give people as they're looking at trying to place someone is that the factor that they really do need to consider is how often they can visit a relative, because it is absolutely clear, even in the best facility, that the residents who get visited regularly get better care than those who don't. It just happens. It's not malevolent. It's not by intention, but it happens.
And half the residents do not get visitors.
Yeah.
Isn't that the case?
Yeah.
Wow.
And particularly with assisted living facilities, we've got a lot of people who are in assisted living facilities who wouldn't be there if they had families or support systems around them. It's just, that's the way it is. And it's just true. That's what happens.
Bob asked another question, if there's a possibility of getting like a Leandro type of decision, if someone, could assemble litigation efforts, like, is that possible? Does that just require some retired, prosecuting litigator who takes that on?
I'm not an expert in class action suits by any means, but you would have to show that large numbers of residents were having their civil rights. Now, Lisa's not a lawyer, but she plays one in this podcast. That their civil rights under federal law were being violated. Then maybe you could have a class action suit, but I'm not at all sure of that.
I think the closest thing we had to that was the disability rights suit that essentially moved the state to make changes in how they treat people with mental illness and adult care homes. Because we were just, as a matter of course, using adult care homes as a placement alternative outside of institutions, and they sued and won, in terms of the state needed to have a better defined plan of services and support for that population.
And we know that that's taken a decade to even begin to
Absolutely.
move the needle on that. So,
Absolutely.
yeah, Bob also asked, do the stars change at the time of the penalty being charged or when the monetary situation is resolved, or what, like when do the stars change? Lisa, you had some
I had just called to find that out because there was such a delay in the penalties that, you don't want it to be 3 years later. But I was told that, they have the, the IDR, the panel that reviews it. And then once, I think it's within 45 days of that notice that the star rating does change. So that I think is helpful because that's somewhat timely. That's what we were told.
But it does not change as long if the facility decides to appeal. So as long as appeals are pending, and that includes the administrative appeals, the penalty, it doesn't affect their star rating.
Mm-hmm.
So the penalty doesn't occur until the facility has agreed to stop contesting.
Oh, wow. Okay. And then Bob also asked about, stronger federal oversight, but, and, the thought about this, but it occurs to me that part of that is that, these are not paid for by Medicare. So you don't have that federal involvement, right? Or am I wrong?
So we do have federal involvement in the sense of a Medicaid payment for a lot of these facilities.
Mm-hmm.
The big picture is the feds oversee the nursing homes and the state oversees and regulates assisted living.
Mm-hmm.
Exactly. And that's true nationally. Assisted living looks different in every different state.
Yeah, we got a great comment here from Marty Nisley, who's the reviewer for that disability rights adult care home litigation. And she says she's a reviewer of adults living or at risk of moving to adult care homes. My team and I are in adult care homes regularly. We're issuing our report for FY 2021 soon. I'm happy to summarize these results and what we've found and reported for this group at some future point. So thanks, Marty. Yes.
That'd be great.
We look forward to seeing that report. You always bring insight to this situation.
I just wanted to mention another safeguard that facilities that the laws include is that if an operator has these pending serious violations, they cannot expand. They cannot build new homes, expand. And that may not sound like an important tool, but we've seen in the last couple of years, every year the industry tries to get the provision in the legislation to remove that. So clearly it's an important tool. So, that's a stopgap, but it is an important tool. So it's important that we have these penalties, the ability to close a facility that just can't get its act together, and the ability to say, get the facilities that you manage currently to a quality level before you can expand. And that's an important tool to them. So we need to make sure that stays in place. So that's why we need to have an advocacy network, because it takes all of us working together.
Another issue that I think bears well with this is there is a process that almost all facilities use, and that's that when on admission, they require people to sign arbitration agreements. So as a condition of admission, they push these papers across to you, and one of them says, I agree, I won't sue you, that if something bad happens, I agree to go into arbitration. And usually the facility gets to pick the arbitrator, and those almost always go in favor of the facility. We have advocated for changes in the law that make that so that you can't do that. It's not to say that we want to take away an individual's right to have arbitration if they want it. So a post-dispute arbitration agreement is their choice. Mm-hmm. Once they understand what happened, and if they want to go into arbitration, they can. But these things lock them into those mm-hmm. ahead of time.
Mm-hmm. Well, I think we could keep going, but it's 7 minutes past the hour. And one of our goals with Healthcare Half Hour is to keep it around a half hour, spur some conversation, get some ideas out there, maybe help awareness out in the general public. So I want to thank our panelists this morning. I mean, do you folks have any last thoughts, Bill or Lisa
do.
or Tommy?
Yeah, I just want to make clear that there are, out of the 428 assisted living facilities in North Carolina, a lot of them do a really good job. They
Yeah,
really care
absolutely.
about the residents. If you're sitting there freaking out because, you know, mom's in one of these facilities, it may not be necessary. She may be fine. There are, you know, as a news person, it's my job to write about the times when things don't go well. Before COVID, I had the liberty to write about, you know, swimming programs and things that people did that really helped residents. So that's all I got.
I just say thank you to North Carolina Health News for bringing these topics to the public. They're important, and communication of them will help us address any problems like these. So thank you for being there.
I agree. It's been a pleasure to be with you, and you introduced Tommy as an award winner. Tommy won our award not once but twice.
Which is not supposed to be possible, right?
Right. Well, I just want to remind folks that North Carolina Health News, we are not for profit. Your donations help keep us going. And also, you know, we are, if you want to keep up with everything, you can sign up for our newsletter, go to the website and you can sign up. And we do this every month. We cover different topics every month. We've talked about mental health. We've talked about autism. Next month, we're talking about environmental issues in the Eastern Coastal Plain. So keep watch on the site to see what you're interested in and see if we address this. And this conversation will be posted to our YouTube page, and we'll have it up on the website by this afternoon. So thanks so much, everyone. And thanks for being with us, and have a great day.
Okay. Great discussion. Thank you very much. Bye-bye.